All right, guys, Dr. Ash here is talking about stress and coping today. Stress and coping. All right, let's get started. All right, so let's talk about anxiety. So, anxiety is actually a very normal response to stress. Really, nothing crazy here. Yep, sorry, there is a delay tonight between her telling me recording is in progress and when it's actually happening. So, anyways, anxiety is a normal response to stress, y'all. Anxiety is normal. I know everybody says, "Oh, I've got anxiety," but guess what? It's normal. We all have anxiety. The thing to remember is that anxiety is very patient centered. So, anxiety for me or you is different for someone else. And so, we just have to remember that. And it actually happens in response to either a threat that is real or perceived. So, I either see a bear charging me or I'm afraid that it's going to happen. And so, oftentimes, you feel very apprehensive, uneasy, maybe uncertain, but it's not really harmful, so to speak. So we have a couple of different types, and then we'll go into the different levels of anxiety. So types: normal, healthy, nothing too crazy. An acute versus chronic. Acute is really like a loss or change that actually threatens a person's security. So like I lose my house and I no longer have shelter, that's going to cause some anxiety. Or maybe my lights got cut off and we know that it's cold right now. That would cause me some anxiety. Versus chronic, it means daily activities are impaired. So that is also a major difference. Now, let's talk about the different types of anxiety. We have mild, which is just tension that happens in everyday life. We know that our senses are aware. We can hear better. We can see better. If you don't think I'm being truthful here, just think about the times you sat in a test. You don't notice all the chatter and everything until you're sitting in a test and you're like, oh my God, is she going to click that pencil one more time? Or, oh my God, will she quit moving her foot? Because your senses are heightened. And so this is actually quite beneficial. It helps produce growth. It helps learning. It helps you focus. You might be restless, maybe a little bit irritable, and just a little bit of mild tension. When we go to moderate, that's more focused on immediate concerns. And so our perceptions are still there, but they're very narrowed. So I kind of only see the threat. I don't really pay attention to anything else. We do know that people can still learn and problem solve during this stage, but it's not as good as during mild anxiety. And then oftentimes we see a little increase in heart rate. They may be sweating, a little diarrhea, headache, got to go pee, mild tremors. I actually get moderate anxiety when I have to talk in front of a crowd, believe it or not. And here I am making YouTube videos. All right, severe. This is like a very bad feeling, like something's going to happen. We know that our senses narrow even more. We get very focused on very small, minute details that don't really matter. We're not really into problem solving or learning at this point, and we're really more focused on reducing our anxiety. The symptoms are going to be headache, nausea, dizziness, sleep disturbances. It might start shaking just a little bit more. I feel like my heart is pounding. I'm hyperventilating. I just absolutely know that something is about to happen. Like I just have that sense that it's bad is coming. Versus panic, this is going to be dread and terror to the point where there's no reality perception. So here's the biggest difference, right? During severe, you still know that things are happening around you, even though you're not paying attention to them. You're more focused on the sense of bad, something's happening bad. However, panic, you have no rational thought. You have no idea what else is going on around you. And this can actually lead to exhaustion and in some cases death because your body is overdoing it to the point where you cannot function anything else. Oftentimes, this is pacing back and forth, shouting, screaming, very impulsive and erratic behavior that make no rational sense. So remember again, between severe and panic, there's no rational thought. Like, I'm going to explode right now, or they're coming to shoot us all up. Just very, very bizarre behavior. Whereas severe, again, I know something bad is going to happen, but I do know that there's some other things going on around me. I'm just not paying attention to those things. So some nursing considerations that you want to think about. We definitely want to establish trust and we want to protect the client. So we really have to be like, hey, I'm here to help you. Please be very calm with these patients. Remember, their high anxiety can often lead to your own anxiety, but that just makes things worse. So very clear, very simple commands, very calm, engaging voice, letting them know you're there, letting them know that you will help them. You will not let anybody harm them in that immediate danger. Of course, we have to set limits because sometimes the panic level, they can get out of control. So we got to be very careful about that. We do not criticize. That is not our place. So remember, again, anxiety is either a perceived or real threat, and it is patient-centered. So you can't tell me what I think is coming. Okay, so be very careful about criticizing your patients. Creative outlets, have them draw, have them jump on a trampoline or one of those exercise jumpers, have them do some sort of exercise, but there has to be some sort of creative outlet. Writing or journaling their feelings may help. We also want to promote relaxation, maybe breathing, some guided imagery, anything to just help calm the patient down. Now, it will get to a point that they may need treatment, medication treatment-wise for their anxiety, and we'll talk about that in just a minute. So for mild to moderate anxiety, we want to get a little more specific on the things that we would do from a nursing perspective. We may want to identify the source of anxiety. Hey, what are the stressors that are happening in your life? Is there something that you want to talk about? Would you like to talk about your feelings? How can we help you? Problem solving. Is this something that, maybe I'm in moderate anxiety and I can't see the outcome? Help them see the outcome. Help them see what the worst possible case is, and then how to approach whatever impending threat or doom or whatever they feel is about to come. For our severe to panic anxiety, again, we want to make sure we reduce their anxiety. We want to be calm. We want to stay with the client to protect them, minimize outside stimuli, right? So if there's a fight going on in the day room, you want to take them out of the day room. Very clear and simple statements. You may have to repeat instructions more than one time, and we want to try to use a very low-pitched voice. We don't want to be very high and musical because it can completely make them even more agitated. So just a very low, calm-pitched voice will be fine. Let's talk about PTSD real fast. Post-traumatic stress disorder. This is usually a response after a severe psychological trauma, and I don't mean like a lot of times people joke around, oh, that test was traumatizing. No, I mean like terrorism. You're in active combat. You're a victim of rape or crime or abuse or anything like that. It can happen, or it can occur about a month, anywhere up to a month to years after an incident. So we have to be very cognizant that PTSD can last for quite some time. It is often characterized by recurrent nightmares and flashbacks. Oftentimes our patients seem to want to avoid things, or they're withdrawn, detached. Like, Jimmy comes back from the war and he's just not the same. He doesn't show affection anymore. Very irritable. They may have anxiety and sleep issues, flashbacks again, poor concentration, and even survivor guilt, especially those in the military or acts of terrorism. Basically, why am I alive, but yet my friend is dead? So survivor guilt's a big thing. From a nursing perspective, we want to make sure that we're non-judgmental and supportive. We want to let them know, hey, this is a expected response. I don't like to use the word normal necessarily, but just say this is an expected response after a trauma. I understand. I'm here for you. Provide reassurance. There are ways to get through this. We want to monitor them for suicide. They are high suicide risk. And of course, we want to assist with coping skills because our PTSD patients, high risk for drug and alcohol abuse. So be very careful with that. The other thing I want to talk about is conversion disorder before we hit our medicine of the hour. So conversion disorder is actually a neurological symptom. Well, it starts neurologically, but there's no real cause. It's also known as non-organic. And so basically what that means is I've had a chest x-ray, I've had a CT scan, I've had an MRI, they can't find anything wrong, yet I still have this neurological symptom. Oftentimes it is an expression of some sort of moral conflict or anxiety producing, and the anxiety actually relieves the stress. I mean, the physical symptom they present relieves their stress and anxiety from whatever conflict is happening. And again, these are mostly neurological. So we're talking like seizures or sensory deprivation, paralysis, inability to talk, So our biggest things here, we want to make sure we assess for recent stressors and, like what's been going on in your life. Let's talk about how you're feeling, things of that nature. And then, of course, our coping strategies. Last but not least, we have our medications for anxiety or stress and coping, I should say. And the number one here is benzodiazepines, always and forever. And they can be identified because they usually end in LAM or PAM. So I always say a nurse's best friend are lambs and Pams because they are great for anxiety. They're used for other purposes as well, but anxiety is the most common cause for these drugs. And you may even know someone or be prescribed this yourself, but alprazolam, midazolam, lorazepam, escitalopram, no, not escitalopram, sorry. I'm trying to think of alprazolam. I mean, there's just so many of them. I can't even tell you. Anyways, the biggest thing is they tend to make people very sleepy because they're considered downers. And so at all costs, we want to avoid alcohol because the combination of the two can actually cause respiratory depression in our patients. So you want to make sure they always avoid alcohol. And that is it for stress and coping. Yes, it is. And so I will see you guys in the next recording. Take care now.